Ever found yourself in this all too familiar scenario? It's the middle of the night, 3 outs a.m., and once again, you're making that familiar trek to the bathroom. And it's probably not the first time tonight. This constant cycle of waking up doesn't just disrupt your sleep, it actively saps your energy, mental clarity, and overall well being for the entire following day. With each dark journey, a wave of frustration washes over you, especially when your partner remains blissfully asleep, seemingly undisturbed. You can't help but ask yourself, why me? Is this simply an unavoidable part of getting older? Many people unfortunately accept this as truth, resigning themselves to persistent fatigue, the anxiety of navigating in the dark, and the belief that a full night's sleep is a thing of the past. However, I'm here to deliver a very clear message. It absolutely does not have to be this way. You are not destined to a life of broken sleep and perpetual exhaustion. I'm Dr. Grace Prescott, a medical doctor with more than 2 decades of experience. My career has been dedicated to demystifying the complexities of the bladder and urinary system. Countless individuals, men and women just like you, have walked into my office feeling utterly desperate and without hope. Yet, time and again, I've witnessed truly remarkable turnarounds. What I'm sharing today isn't generic advice. It's a fundamental strategy from the field of urology, a precise method detailing how, and more crucially, when to consume water, which will finally allow you to reclaim your nights. It's a technique so straightforward, so logically sound, yet so commonly overlooked, you'll likely wonder why you hadn't discovered it sooner. Stick with me because this knowledge isn't just going to transform your nights, it has the potential to transform your entire life. Before we dive into the solution, I want you to grasp the true magnitude of this issue. Are you aware that a staggering 70% of adults over the age of 60 wake up at least once during the night to urinate? For many, it's two, three, or even more times. This condition has a specific name, nocturia. And let me state unequivocally, while it's prevalent, it is not normal. It's not just an innocent consequence of aging. It's a blaring alarm in the night, a critical warning signal from your body, and the implications of ignoring it are far graver than you might imagine. Stay tuned until the very end because I won't just explain why this occurs, I'll unveil the exact strategy, the very method we teach our patients to break free from this exhausting cycle. I guarantee that this final revelation could revolutionize your nights forever. We're facing a silent epidemic with hidden dangers. Nocturia is rightly called a silent epidemic because people rarely discuss it openly. They endure it in isolation, feeling a sense of shame or simply resignation. But in the privacy of my practice, I hear the genuine stories. I hear about Michael, a 72-year-old grandfather who once loved meticulously crafting model ships and bottles, but had to give it up because his hands trembled uncontrollably from chronic sleep deprivation. I hear about Susan, a 68-year-old retired teacher who suffered a fractured hip after a fall during one of her nighttime trips to the bathroom, an accident that ultimately cost her independence. These aren't just isolated incidents, they represent a harsh reality. The problem extends far beyond simply feeling tired. Let's talk openly about the serious risks associated with these nocturnal bathroom visits. Firstly, there's the increased risk of falls. In the dark, disoriented from sleep, your balance is severely compromised. The path to the bathroom becomes a hazardous obstacle course, a misplaced rug, a piece of furniture, and the potential outcome is a life altering injury. For an older adult, a hip fracture can often mark the beginning of a rapid decline in health. Secondly, consider the impact on your cognitive health. Deep sleep isn't a luxury, it's an absolute necessity. During this crucial phase of sleep, your brain performs vital functions. It cleanses itself, consolidates memories, and eliminates toxins that have accumulated throughout the day. When your sleep is repeatedly interrupted night after night, this essential cleanup process is hindered. The result? Brain fog, difficulty concentrating, impaired memory, and over time, an elevated risk of neurodegenerative diseases. It's not your age making you forgetful, it's the severe lack of quality sleep. Thirdly, there's the significant strain on your heart. Each time you're abruptly awakened, your body releases stress hormones, causing your blood pressure and heart rate to spike. If this happens multiple times every night, you are subjecting your cardiovascular system to relentless stress. Numerous studies have established a link between severe nocturia and a higher risk of hypertension and other serious heart conditions. And finally, we mustn't overlook the profound emotional toll. Persistent fatigue robs you of your joy. It fosters irritability, anxiety, and can tragically lead to depression. It distances you from the activities and people you love, trapping you in an exhausting cycle that feels nearly impossible to escape. You essentially stop feeling like yourself. So, why does this phenomenon become more common as we age? Several factors contribute. First, your body produces less antidiuretic hormone, ADH, at night. ADH is responsible for signaling your kidneys to reduce urine production while you sleep. With insufficient ADH, your body's urine factory continues operating at full capacity. Second, your bladder capacity may naturally decrease over time. And thirdly, a factor few people are aware of, fluid redistribution. If you experience some ankle swelling during the day, that fluid doesn't simply disappear. When you lie down, gravity no longer holds it in your legs. It re enters your bloodstream, passes through your kidneys, and ultimately ends up in your bladder, leading to you waking up a few hours later. Now that you fully comprehend the seriousness of this problem and the underlying science, we are ready to dismantle the myths and construct an effective solution. Let's debunk the myths, the mistakes that only make things worse. Before I share the correct strategy, we first need to stop engaging in practices that are detrimental. Most people, despite their best intentions, make common errors that actually exacerbate nocturia. It's time to expose the three most prevalent myths. Myth number one: to avoid nighttime urination, I drink as little water as possible during the day. This is the single most common mistake. And believe me, it's the most counterproductive. It seems logical, doesn't it? Less liquid in, less urine out. But your body is far more complex than that. When you intentionally dehydrate yourself throughout the day, your urine becomes highly concentrated. This super concentrated urine can irritate the walls of your bladder. Think of it like pouring lemon juice onto a cut. That irritation can make your bladder hypersensitive, sending urgent go to the bathroom now signals even when it's not truly full. Furthermore, when you finally succumb to intense thirst in the afternoon and drink a substantial amount, your body, now in a state of conservation, tries to process all that liquid at once, often during the night. Paradoxically, drinking too little during the day can lead to more bathroom trips at night. Myth number two: the problem is I have a small bladder. I've always been this way. While some individuals might indeed have a slightly smaller functional bladder capacity, in the vast majority of nocturia cases in adults, the real issue isn't the size of the tank, the bladder, but rather the pace of the factory, the kidneys, at night. As we discussed, reduced ADH production and fluid returning from the legs are the primary culprits. You could possess the largest bladder in the world, but if your kidneys are constantly producing urine, you will still wake up. Blaming a small bladder is an excuse that prevents you from addressing the true root of the problem. And no, it's not something you simply have to accept and live with. Myth number three: a glass of wine or a beer helps me relax and sleep. It can't be that bad. This myth is particularly damaging. While alcohol might initially induce drowsiness, it actually sabotages your rest, especially concerning nighttime bathroom visits. Alcohol is a potent diuretic, but even worse, it sharply suppresses the release of that crucial antidiuretic hormone, ADH. So, when you consume alcohol before bed, you're creating a disastrous combination. First, you're introducing liquid, and second, you're effectively turning off the natural brake your body uses to minimize urine production at night. It's the perfect recipe for nocturia. Additionally, alcohol severely disrupts the quality of your sleep and often causes you to wake up during the second half of the night, precisely when your bladder is also signaling distress. Avoiding alcohol, particularly in the hours leading up to bedtime, is one of the most impactful changes you can implement. Now that you understand what doesn't work, you've already made significant progress. You've cleared the path. Are you ready for the strategy that truly delivers results? Introducing the smart hydration strategy. This is the core of our discussion, the precise method that has restored peaceful sleep to countless patients. Forget the old advice of drink less. Our new mantra is drink smarter. The ASIM method is a straightforward 5 step strategy, easy to remember. ASIM is an acronym for adjust, soften, stop, integrate, and manage. Let's break down each step, and then I'll provide 2 additional crucial keys for a completely foolproof protocol. Step 1, adjust your hydration. Drink more in the morning. The fundamental principle here is to front load the majority of your liquid intake into the first half of your day. The golden rule I share with my patients is this: aim to consume 75% of your daily liquids before 4 p.m. How do you achieve this? Begin your day by drinking 1 or 2 substantial glasses of water right after waking up to jumpstart your system. Throughout the morning, keep a water bottle close by and take consistent, steady sips. Do not wait until you feel thirsty. Thirst is already a signal of dehydration. With lunch, consume another glass of water. By following this pattern, you give your kidneys the entire day to process liquids while you are active and upright, essentially working in harmony with your body. By 4 p.m., you will be perfectly hydrated, and we can then begin preparing for the night ahead. Step 2, soften the transition. Land gently. From 4 p.m. onward, avoid abruptly cutting off your water intake. Instead, we enter the landing phase. From this time until dinner, gradually reduce the amount you drink, perhaps half a glass if you're genuinely thirsty. Dinner is a critical point. Try to finish your meal at least 3 hours before you plan to go to bed, and during dinner, drink only enough to help you swallow your food. A few sips are fine, a full glass is not. This gradual reduction signals to your body that it's time to slow down urine production. Step 3, stop in time, the sacred zone. This is the strictest and arguably the most crucial step. Establish a sacred zone of 2 hours before bedtime during which you consume absolutely no liquids. If you typically go to bed at 10 p.m., your last drop of liquid should be no later than 8 p.m. No exceptions. This 2 hour window provides your kidneys with the necessary time to complete their final filtering and send any residual urine to your bladder before you fall asleep. If you drink within those 2 hours, it's almost guaranteed your kidneys will be in overdrive when your head hits the pillow, setting you up for an inevitable bathroom trip around 1 or 2 a.m. If your mouth feels dry, rinse it without swallowing or take a minuscule sip, but avoid drinking a full glass. This rule is paramount. That covers the core ASIM method. Now, let's add 2 extra steps that will significantly enhance its effectiveness. Step 4, integrate electrolytes. Improve absorption. This is a clever trick to help your body utilize water more efficiently. Hydration isn't merely about drinking water, it's about ensuring that water reaches your cells. Electrolytes play a key role in this process. The concept is simple. In your first glass of water each morning, add a tiny pinch, just a pinch, of unrefined sea salt and a splash of lemon juice. The salt provides sodium, which aids in water absorption by your cells, and the lemon contributes potassium. This simple addition can make your morning hydration far more effective, subsequently reducing thirst in the afternoon. Step 5, manage your dinner. Control the sabotagers. What you eat for dinner is just as important as what you drink. For your last meal of the day, avoid spicy or acidic foods as they can irritate the bladder. Limit excessive sugar or simple carbohydrates, which can increase urine production. Steer clear of high water content foods like soups, watermelon, or cucumbers. Consume those earlier in the day. Also, avoid chocolate and caffeine, both of which are bladder stimulants. And of course, absolutely no coffee, tea, or sodas. Instead, opt for a dinner rich in protein and cooked vegetables. This combination helps keep your blood sugar stable and avoids overwhelming your system. There you have it, the complete ASIM method. It's not magic, it's simply applied science. To further boost your results, consider these supporting techniques. If the ASIM method is the engine, these techniques are your high performance tires, maximizing your outcomes. Supporting technique 1, double voiding. Ensure your tank is truly empty. Have you ever used the bathroom right before bed only to feel the urge again a mere 20 minutes later? This happens because your bladder wasn't completely emptied the first time. The double voiding technique is both simple and remarkably effective. Just before heading to bed, go to the bathroom. Sit on the toilet. Yes, men, this applies to you too. Sitting helps relax your pelvic floor muscles, allowing for a more thorough emptying. Once you think you're done, don't immediately get up. Wait approximately 30 to 60 seconds and relax. Then lean slightly forward and attempt to urinate again. You'll be surprised how often a little more comes out. That little more can be the crucial difference between sleeping through the night and waking up at 3 a.m. Make this your regular bedtime ritual. Supporting technique 2, the gravity elevator. Manage fluids proactively. Remember the fluid that returns from your legs? We can get ahead of that process. The solution is the gravity elevator. 1 or 2 hours before bedtime, while you're reading or watching TV, elevate your legs above heart level. Prop them up on pillows, on the couch, or in bed. This leverages gravity to your advantage, encouraging that fluid to return to your circulation before you lie down for the night. Your kidneys will then process it, and you can eliminate it with your double voiding technique. You are essentially proactively milking your legs so they don't unexpectedly milk your bladder while you sleep. Wearing compression socks during the day can also help prevent fluid buildup in the first place. Supporting technique 3, salt shaker control. While we advocated for a pinch of salt in the morning, excessive salt in your overall diet is detrimental for nocturia. When you consume too much salt, your body retains water to dilute it. This makes you feel thirstier, leading you to drink more. Furthermore, your kidneys have to work overtime to eliminate that excess salt, and they require water to do so, which then turns into urine. Be mindful of processed foods, deli meats, and ready made meals, as they are often high in hidden salt. Cooking at home gives you greater control over your salt intake. Reducing salt not only benefits your bladder, but also significantly helps your blood pressure. We've unmasked nocturia not as a mere annoyance, but as a genuine thief of your life and vitality. We've shattered the myths that have kept you trapped in this cycle, and I've provided you with the essential keys, the ASIM method, and powerful supporting techniques to regain control. I recall my patient Michael, the model shipbuilder. After just 2 weeks of consistently following this protocol, he called me. His voice sounded remarkably stronger. "Doctor," he exclaimed, "last night I slept 7 hours straight. 7. I hadn't even remembered what that felt like. This morning, my hands weren't shaking at all. I'm back in my workshop. I'm not just sleeping more, I feel truly alive again." That same transformative experience is entirely possible for you starting tonight. Reclaiming your sleep is a conscious decision, the decision to actively apply everything you've learned today. Your action plan is clear. Adjust your hydration, ensuring the majority is consumed before 4 p.m. Soften and stop. Gradually reduce your intake in the afternoon and strictly observe the 2 hour sacred zone with absolutely no liquids before bed. Integrate electrolytes for better absorption and manage your dinner choices to avoid bladder irritants. Support your body further with double voiding, leg elevation, and careful salt control. You now possess the knowledge. You have the tools. The power to fundamentally change your nights rests squarely in your hands. If you found this information valuable, I have 3 simple requests. First, please hit the like button so this video can reach more people who desperately need it. Second, subscribe to my channel so you won't miss out on other life-changing health insights. And third, and this is truly important to me, please go to the comment section right now and tell me how many times you currently get up at night. Share your number. There is absolutely no shame here, only a supportive community of people who understand precisely what you are experiencing. By writing it down, you're not just taking the first crucial step for yourself. You're also helping others realize they are not alone in this struggle. Thank you for your time and your trust. Now go forth and prepare for the best night's sleep you've had in years. You absolutely deserve it.